So this is the small-scale goat keeping, day 2, and it's about keeping goats in small holdings in Victoria. So the topics to be covered are the gastrointestinal worms that affect your goats, how to know when your goats are affected by worms and how to treat them, clostridial vaccination and vaccine care, and a vet-client relationship. So let's talk first about parasites, or any disease actually. You've got 3 factors. The first is the environment, the second is the goat, and the third is the disease organism or the worm. Let's talk about the environment. Browsing goats don't get worms. Worm larvae can't climb up as high as browse. So if the goats are always eating with their heads up, then the goats won't get worms. Feedlot goats, so long as the feeders are well designed, they also don't get goats. And this commercial dairy goat producers are generally all feedlot. They can't afford to waste goats' milk by using the milk withholding periods, and there's very few drenchers actually registered for goats that are actually milking for human consumption. So most commercial dairies are feedlot. But feedlotting means absolutely no green patches and having well-designed feeders, not feeders that the goats can jump into. So fence line feeders are excellent, as shown here on the left. On the right is a feeder that's been used to feed kids grain. And this has just got a hot wire over the top of it that's come out from the hot wire on top of this electric fence. And that's to prevent the kids from jumping into the feeders and contaminating the feed with manure that's on their feed. This is a hay rack design that I use with my goats, though these aren't my goats. It's designed so that the goats have to turn their head in on the side to get into the hay feeder. And so they tend to leave their heads in, and so they waste less feed because the feed that drops out of their mouth just goes into the bottom of the hay feeder. You have to just make sure that no little kids can jump in. This is not the feeders that you want to use. If kids can jump into them, or if goats can get their feet into them, then that feed's going to be contaminated with worm larvae. Worm larvae is on the pasture, especially wet pasture. And this pasture, the worm larvae are there. They crawl up the grass, getting up onto the top of the pasture, and they're generally in the dew. So you have to keep the pastures as tall as possible. And the one thing goats have got going for them is that the goats will graze from the top down, whereas cattle and sheep will graze at the bottom. So if you keep your pastures high, ideally as high as possible, then you're going to be less larvae are going to be eaten by your goats. So this is a graph on its side showing the number of infective worm larvae on a piece of grass. Some worm larvae are protected underneath the soil. About over 50% are in the first 5 centimetres, and the vast majority are in the first 10 centimetres. So if you can keep your pasture ideally 10 centimetres or at least 5 centimetres in height, you'll get less worm larvae. The other thing you can do, and I like to think of this as vacuuming your pasture of worm larvae, is by using a horse. A horse doesn't share any worm species with goats. So if you can borrow a neighbour's horse or offer some free pasture to your neighbour and use them to graze your pasture right down, and then only let your goats back in when the pasture is regenerated and has got 5 to 10 centimetres in height, you're really going to reduce the worm larvae on that pasture. So let's now look at the goat section of the disease triangle. If you can select either on Fermat's scores, which is looking for the resilience of the goats, so it's the ability for the goats to do well even though they have a worm burden, then that's one method of selection. Only works for Barber's pole worm. So the Fermat scores are only for Barber's pole worm. You can also select on fecal worm egg counts, and this is selecting for the resistance of the goats to worms. And this is all worms. And that's a method that can be used. Meat and Livestock Australia have actually done some trials with bucks looking at the difference between the offspring of bucks in their worm egg counts. And there's a huge difference. Or if you can't do your own selection, you can buy goats from a breeder who's with good genetics that have been proven in a trial, or with estimated breeding values based on worm egg counts. So this is a copy of the estimated breeding values, and you can see there an estimated breeding value for the worm egg counts, and they go from plus 45 to minus 30. So huge variation. And of course you want the minus 30 because you want a low worm egg count. But we're up against it. The generation interval for breeding goats is about 2 years. That's for the next generation to be born and ready to be mated and produce offspring themselves. Versus, so it's 2 years for the goat. For the Barber's pole worm, it's 17 days. So we're very restricted in how much genetic progress we can make. The other thing we can do, though, is make sure your goats are very well fed, because goats that are well fed are resistant to the effects of parasites. So they're less likely to develop severe clinical signs of worms. When you're looking at nutrition, consider the energy first, then the protein, both rumen degradable and bypass protein, and only then consider vitamins and minerals. There is no magic vitamin or mineral that's going to protect your goats from worms. The other thing to remember is that 20% of the herd are going to be producing 80% of the worm eggs on your pasture. So if you can identify those goats and find them a new home where they're fed a feedlot, you can get those goats that are contaminating your pastures out of your herd, and this will really reduce the larval burden on your pastures. The other thing to be aware of is what's called the periparturient rise. Goats in late pregnancy and early lactation are producing very high numbers of worm eggs. The worms themselves respond to the hormones in the goat. Those that are hibernating in the gut wall will come out and develop into adults and start laying lots of eggs. The worms that are already in the gut will start laying more eggs than normal. And so does in late pregnancy, they are really going to be producing lots and lots of worm eggs. And this is the worms' way of making sure they infect the next generation of goats. So be aware of that. Keep an eye out on these goats. They're going to be very susceptible to worms. The other thing you should be remembering is that goats that are suffering from other diseases are very prone to worms. So goats that have CAE, you can see the enlarged knees here in this goat, very skinny because CAE causes wasting. They're going to be very susceptible to worms. This Anglo-Nubian here, very poor body condition again, some intermittent scouring, and this goat has Johne's disease, had very, very high worm egg counts that didn't respond to drenching. The owner just thought it was a case of drench-resistant worms in the herd, but it was actually a case of Johne's disease. So let's now look at the worms themselves. We used to say, when I first graduated a long time ago, that you should drench your goats, all the goats, and then shift them to a new pasture. And this just meant that the worms that did survive were those that were resistant to the drench, and they then mated with other goat worms that were resistant to the drench, and so there was a rapid build-up of drench-resistant worms. Now we say you only drench some goats and they should stay in the same paddock. And this means that if you do get some drench-resistant worms, they're going to mate with non-drench-resistant worms, and it's not going to concentrate those genes. But it is a balance. We talk about refugia, which are the eggs and larvae on the pasture, and the worms in the untreated goats. And you want to have maximised refugia so that they are non-drench resistant worms. But you have to balance that out between the loss of production and the need to treat goats that are less resilient with the need to prolong the effectiveness of worm drenches. There are no new worm drenches in the pipeline, so we have to manage the worm drenches we already have. Now, the most dangerous worm is Homunculus contortus, or the barber's pole worms. Now, only some farms in Victoria have this worm, so you need to know if your farm has barber's pole worm. Unfortunately, it is spreading. You can test this by larval culture or PCR test. Now, Homunculus contortus, they actually have a little sharp lancet in their mouth, and they make a little wound in the fourth stomach, and this wound then releases blood that the female worms then digest and use it to make eggs. So this is what the fourth stomach looks like. Sometimes you may not see the worms if a goat has died of barber's pole worms, but you will see little pinpoint red spots where the damage that that lancet had done to the lining of the fourth stomach. Even if the worms have, it's like the rats that leave a sinking ship, the worms detach and get passed out if the animal is dying. So this is the life cycle. You have the adults in the gut, and these are producing worm eggs, and it's the same for all different types of worm eggs. This one is barber's pole. Then those eggs will hatch in the manure and turn into larvae, first stage larvae, and these then go out of the manure and they climb up the grass on the dew and they wriggle to the top, and then another goat comes along and eats them, and then these third stage larvae then develop into adults. Now, with barber's pole worms, they can do that in 17 to 18 days. The scour worms or Trichostrongylus worms will take slightly longer, about 23 days, but all worms have a similar life cycle. But Homunculus contortus, they can hatch in 4 to 6 days, slower if it's cold, faster if it's in summer. They like 70 degrees humidity and a maximum daily temperature of 18 degrees. So their larvae stay on pasture for months, 35 days if it's hot, and 4 to 6 months if it's cold. So it takes on average at least 60 days for pasture becomes safe, and their life cycle, it's 15 to 21 days, but around that 17 or 18. We've also noticed, and this is from a scientific reference, that Haemonchus is increasing its range. So the black and white diagram here is the spread of Haemonchus a long time ago, but now you can see both in Victoria, the areas where Haemonchus is now is a lot bigger than what it used to be. Clinical signs of Haemonchus are bottle jaw, and this is associated with low protein. Low protein in the blood means that the fluid will accumulate outside the blood circulation, and that's generally underneath the jaw. It's not always Barber's pole worms, but it's most commonly Barber's pole worms. You could also get it with liver fluke, and you can also get it with Johne's disease. You get a severe anemia. Again, this is Barber's pole worms, but it could also be liver fluke or Johne's. So you can use what's called the Fermacher system, and the Fermacher system is a way of classifying the mucous membranes around the eyes. So obviously, if they're white, that's a Fermacher score of 5. If it's nice and red, which is pretty rare in goats, that's a 1. I've only seen it in a few goats. And that's the opposite of condition score. So you can remember this, that 5 in a condition score is obese. So you can see the fat being deposited under the tail, which is always a sign of condition score 5. And 5 is fatal in the Fermacher score. So just remember they go the different ways. If you do a Fermacher course, then you can buy Fermacher cards. And this is a good way of checking your goats. In Barber's pole areas, you should be doing that weekly, because goats can die of severe anemia before they lose any body condition. And so you can just find them dead. The other types of worms are your Trichostrongylus, your Osteotarsia, your Nematodeurus, and these cause scouring. Now, it may not be actual scours. It may just be that the fecal pellets are clumped together, sometimes with mucus. So the way that you, so these are the other main worms. You've got your black scour worms, your Trichostrongylus, your brown stomach worms, which are your Teledosargia or Osteotarsia is their old name. And these are, again, like your Barber's pole in the abomasum. And you actually can see them sort of moving as a mass. You can't see the Trichostrongylus worms and you can't see the Nematodeurus worms. They're just too tiny. You can't see them on a postmortem. The other indication are rough coats and poor body condition. So worm egg counts is what you need to be doing. So you can send these away to your local vet if they do them, or to a commercial lab. And this is a way of getting a result that's eggs per gram. You can tell Nematodeurus eggs. So there's a Nematodeurus egg here on the right and a strongyle egg here on the left. This is a better photo of a strongyle egg. Now, you can't tell Barber's pole worms or Trichostrongylus or Teledosargia eggs. They're all the same. So we group them together and just call them strongyle eggs. But Nematodeurus, you actually can, because they're a lot larger. So you need to diagnose before you drench or confirm before you deworm. Because every time you drench, you are selecting for drench resistance. So you don't want to drench animals that don't need it. You can use the 5-point check to determine which animals should be drenched. So you look at their eye and get a Fermacher score. You do a condition score by feeling along the background. You look underneath the tail to see if there's any soiling. Ideally, you do a fecal egg count. You look at the coat. Is it rough or is it nice and shiny? And you look at the jaw for any bottle jaw. But if there's bottle jaw, you've left it too late because that has caused severe production loss. Now, that's the 5-point test for targeted selected treatment, but you need to finesse this. So you treat all the animals which have a FAMACHA score 4 or 5. You treat any doe that's got 3 or more kids on an ultrasound or born. You treat any goats that are a condition score 1 or 2, and you should treat first kidders after they've kidded. You should think about treating kids and goatlings that are not meeting their average daily weight gains that you want, and that are condition score 3, 4, or 5. And any goat that's above the worm egg count levels that are in your state or district drench decision guides, which you can find on WormBoss. So this is the drench decision guide. You put in goats, you put in your region, you put in the season, or you can just press drench decision guide. There's 2 that you need to be aware of. One is Victoria, obviously, and the other one is Australian smallholders, because the backyards goats are pretty similar throughout Australia. So this is your Australian smallholders WormBoss website, and you can actually print this out. It looks at FAMACHA score, body condition score, fecal consistency. So basically the 5-point check. Or you can use this drench decision tree, and that's looking at your FAMACHA score first, then the body condition score, and then if you've got a fecal sample, you can then get the worm egg counts. So for dry goats, anything that's 750 eggs per gram or higher should be treated. Remember that Homunculus or Barber's pole produce enormous numbers of eggs. Now, obviously, if your FAMACHA score is 4 or 5, they should be drenched immediately because they're in danger of dying of anemia. For kids and milkers, that is not 750, it's 500 eggs per gram. Now, you can't use over-the-counter veterinary chemical products if they're not registered for goats. You can in Victoria, but not in any other state. So in Victoria, you can use them if they're not if they're registered for sheep. You can use them on goats, but you can't use them at the higher dose rates that goats need. The other thing is you should only use a drench that actually works. So in commercial sheep and commercial goats, they use a drench resistance test. Now, if you've got enough numbers, you can actually do this by using individual worm egg counts before and after drenching, but you'd still need around 15 to 20 goats. But a drench check you can do even if you've got only 2 or 3 goats. If you suspect drench resistance, you should do a drench check. And this is basically a worm egg count before and 14 days after, and that's with larval cultures. And you do it at 14 days because you don't want to do it too early, because sometimes the worm drench just makes the worms a bit sick, so they stop laying eggs. And you can't leave it later than that because your Barber's pole worm's life cycle is only 17 days. So I recommend that you do a drench check if you suspect worm drench resistance the first time you use a drench. And when you get near to the bottom of that drench container, then you should be using a drench check, because there's no point in buying another bottle of that same drench if it's no longer working on your farm on your worms. The basics of drenching are you need to check your drench gun. So that means squirting it into a syringe. The syringes are accurate to measure mils. So you want to check the drench gun is actually delivering the dose you think it is. You should weigh the goats or use a heart girth chart, and I've got one on my website. You need to drench over the back of the tongue, and look, a little tiny single dose drench gun is only going to cost you about $30, and it's one of the best investments that you will make. And you should use a combination of anthelmintics from different classes of anthelmintics. So, for example, a white drench and a levamisole drench. So you need to know what worms are in your herd. You need to know the species of worms and their resistance status. You need to treat only those animals that need it based on their body condition score, the FAMACHA scoring, any prevailing circumstances. So, for example, if they've just kidded. And here you can see a little single-use drench done there. Now, we used to be told when I first graduated that you needed to swap your drench guns, drench types, drench families every year. But all that did was made sure that you got resistance to both at the same amount of time. Then we were told to rotate every 5 years. And then we were told to use them until it no longer worked, and then use a drench of a different family. But what they found now, and is what the recommendation now is, that you should use 2 or 3 different actives at the one time. And when you think about it, it means that a worm has got to get 2 or 3 mutations at once in order to survive that combination of drenches or combination drench. These are the drench families. You've got your white drenches, benzimidazoles. You've got your clear drench, which is levamisole, and also Morantil, which is Oraljet. Then you've got your Mectins. Then you've got the new drenches, Zolvex and StarTec. And then you've got the combination drenches, which are a combination of 2 or more different classes of goats. Then you have the narrow drenches, such as Ramitin, which is basically a bit too dangerous to use in goats, in my view, and Closantil, which controls only Barber's poleworm. Then you've got the narrow spectrum drenches, which is triclambendazole and praziquantel, which treat liver fluke and tapeworm respectively. But worm drenches, you've got to take care of them. Don't store them in a garden shed. Read the label. The label tells you the temperature that they have to be in. And in a lot of cases, this means you must keep them in an air-conditioned room in summer. Don't keep them in the goat shed. When the label says shake, you must shake the container. This is some Q-Drench, which is in a glass bottle, and you can see how the components separate out. And if you give the dose and you only get it from the top, for example, then you're going to get an overdose of one of the components, and that may have serious consequences. Now, you need to know the names of the active before you use the drenches. So if you're using Zolvex Plus, Q-Drench and StarTec, you think, well, this is going to be good if I'm bringing in new goats, that you're going to kill all the worms. But what you're actually doing is using abamectin 3 times. So don't use brand names, look at the names of the actives. Many labels of the sheep drenches say do not use on animals used for milk for human consumption. A vet's prescription cannot override a do not use statement, which is, I believe, unfortunate. In New Zealand and the United Kingdom, they have default MRLs, which get around this problem, because basically the drench manufacturers can save a lot of money by not having to do the research to find out the milk withholding periods. So many of them don't do it because they think the market is not large enough to justify that money spent on the research. So I've done many submissions to government reviews about trying to get better access to drenches for goats, but none of them have been successful. They're all on my website if you ever want to reuse them to write to your politicians. You should not use pour-ons, however. They're only registered for cattle. They don't work on goats. So you need, using them helps to develop resistance because you get a long period of time when there's only a very small amount of active there, and this leads to drench resistance. So what is registered for goats? You've got Panacur, you've got the Oralgect. There was Capramec, which then became Vermamec Oral, but now it's only for sheep now on the label. So the options for registered chemicals for goats is not good. Now, I did this in June last month, and you can see there's a large number of drenches there that are actually registered for goats. But if you look at it carefully, you'll see that it's basically all the ones in black are white drenches, and therefore they're all the same. Oralgect, which is your Morantal, and you've got your Verbamec Oral, which is still registered, but it's no longer sold. And there is one permit for one Victorian farm for Cydectin Oral. But the other problem you've got if you're using sheep drenches is that the dose rate is too low. So if you look at the veterinary textbooks, they will tell you that you need to use your white drenches at double the sheep dose rate. So that's Panacur needs to be given at double. Levamisole at 1.5 times the dose rate. And Q-Drench has levamisole, so Q-Drench must be at 1.5 times the dose. And for Zolvex Plus and StarTech, it varies. Some vets use 1.5, some use double. You need a vet's prescription, therefore, if you're going to drench goats. In Victoria, you can use sheep worm drenches in goats, but only at the sheep dose rate and only provided that you don't produce any residues. In Victoria, you need a veterinary advice note, which is what other states call prescriptions. And the Livestock Production Assurance audit a percentage of pigs every year. And if you're chosen, they will look at your drench history, your treatment history, and they'll ask for the prescriptions. And I've been called out at very short notice because an LPA audit is due, and I've had to go up, visit the property, see the goats, inspect the drenches, and write the prescriptions. And this is what a technical advice note looks like. Just the name of the product, the name of the owner, the address details. You'll notice here dose rate and the method of administration is there. So StarTech has a 14-day withholding period for meat for sheep, but you're going to be using that at 1.5 times the dose in goats. So you may need to increase that for goats. Zolvex, the export slaughter interval is 10 weeks. So that this again may need to be increased. So the vets will balance out the higher dose rates that goats need, their faster metabolism, which is why goats need a higher dose rate, but also the fact that the residues need to be below the level of reporting. And for modern science, they're very good at getting down to parts per million or even lower. So if we look at the withholding periods for milking goats, for fenbendazole, which is your Panacur and Parafen, if you're using at the label dose rate, it's 14 days for meat and 2 milkings. Now, your vet may decide to increase that because you're going to double the dose rate. And Abamectin, based on the Capramet label, it's 8 milkings. The Oralgect oral paste only has a meat withholding period and a statement, do not use in milking goats. And all the others say do not use if producing milk for human consumption. Now, in America, they actually do provide milk withholding periods for ivermectin, cydectin, and levamisole. And this is the chart that's on the wormx.info website. And that can be used to guide veterinarians writing technical advice notes. Moving on now to copper oxide wire particles. These provide protection from homuncus only, and they can provide up to 21 days protection, but they are copper, and copper is an accumulative poison, so that you can't use them more than 4 times a year. You can buy these capsules, and these capsules, you can spread them on a slice of bread if your goats like bread. Margarined bread is what's used, or you can put them on a saucer of molasses or some sort of treat that the goats will eat. Any way that they get into the rumen is fine. The dose is 1 to 2 grams for an adult goat and 0.5 to 1 gram for kids and miniature. There's no milk withholding period, so these are really good if you've got milking goats. And it's best to use these in combination with drenches. And it's been shown in America that with the white drenches, even if they're only 60% effective, if you combine it with copper oxide wire particle boluses, it brings them up to 95% effective. There are numerous brand names. They're all registered for goats, but only for annual use for preventing copper deficiency. So these are the brand names of the copper oxide wire particle boluses currently registered for goats, but for treating only for copper deficiency. So if you're using them more than once a year, again, you'll need a technical advice note from your veterinarian. So research in goats has shown that it's good to use if you think you're developing drench resistance and you're still using white drenches. 1/2 a capsule for the weaned kids and miniatures. And you may need to monitor copper levels in butchered animals or animals that die suddenly. And you can just get a lobe of liver and freeze it for sending in the lab. And you need to do this because of the way copper is stored and released. So for most minerals, if you don't have enough, the animals die or they become ill, then you've got this big range where they got maximum production. And then for most minerals, you go down this other side, whereas if you get toxicity, they'll develop illness and then later on they might die. But for copper, it's different. It's like the straw that broke the camel back. The goat will store copper in the liver, store copper in the liver, store copper in the liver, until the liver says, I cannot store any more copper, and therefore they release it all into the bloodstream, and that starts destroying the red blood cells, and the goat's generally found dead. You might find severe anemia, you might find some blood in the urine, but basically you'll find that the goat's dead. Now, the liver might be pale and friable because it's just released all this copper. The urine might be dark brown, and the typical feature is this gunmetal blue kidney. And that's because the kidneys are filtering out all the dead red blood cells that's been destroyed because of the copper levels in the blood. The thing we're finding really good, and I will make a disclaimer here, we do sell BioWormer and send it all over Australia, but I'm convinced that this has been excellent, especially in herds with drench resistance. Now, BioWormer acts differently. It's a product, you can either buy it from your produce merchant with Livamol, which is a protein supplement, which is useful, or you can buy the pure BioWormer, which is what we sell. And the fungal spores that are in the BioWormer hatch in the manure and they lasso the worm larvae as they hatch out, and they kill 86% of the worm larvae in the manure. Again, there's no milk withholding period, so excellent for milking goats. So if you've only got small numbers and you feed them daily, I'd be using Biowormer. Works on the drench-resistant worms. It is expensive, so that's a downside. If it's too expensive for you to use all the time, then use it strategically. I would use it for new introductions to kill the worm larvae that have survived the quarantine drenches that you're given and therefore are resistant worms. So you want to kill those worm larvae and consider using it during that periparturient rise period. The other thing you can use is Barbavax. Now, there is no withholding period, but this requires some priming doses, so you get no response until you've had the third dose, and then you've got to give it every 6 weeks to kill the Barber's pole worms. This is the trial results. They did 3 trials. You can see here on the property G that worked extremely well. You've got very significant difference between the two Barbavax and non-Barbavax. The Dorigo trial, slightly less, and the Chiswick trial, there's really not much significance in that result at all. So they did progress registration. But you can use Barbavax if you have a vet's prescription, and Barbavax can be purchased online if your vet can't get it in for you. But these are the 6 R's of worm control. You need to use the right product on the right animals only, do it at the right time, the right dose rate, administered in the right way, so as a drench over the back of the tongue, and combine that with the right pasture management. I'm moving on now to vaccination, and I like to say vaccination is like life insurance. If you wait until it's needed, it's too late. I like to use your 3-in-1. The dose is 1 ml underneath the skin. Ideally, your pregnant does should be vaccinated 4 weeks before kidding, and this is so that their colostrum will have the maximum amount of clostridial protective antibodies in their colostrum. This is what tetanus looks like in a kid. So I won't show too much of this. It's a bit distressing. The clinical signs are the animals are stiff. The third eyelid goes across. Sometimes the tail stands up, and they will react to strong sounds and go into convulsions. And the reason that young kids can get tetanus is that the tetanus spores can enter the bloodstream. Now, this is a kid that's been opened up, and you can see that there is, from the navel area there, which is in between the forceps, you can see that there's a blood vessel that goes straight through the liver into this bloodstream. There's also another one that goes further back, a vein, as well as a tube that goes to the bladder. And so any tetanus spores that are on the ground, if they then get into the navel, then that's straight into the bloodstream, and those kids can die of tetanus at a young age. Now, kids must be vaccinated. They can't be vaccinated until they're 3 weeks of age. So you vaccinate them then. You can wait 4 or 5 weeks, but I wouldn't wait any longer than that if the mothers were vaccinated in late pregnancy. And then that has to be repeated in a month's time. Dose rate for all types of goats is 1 ml. And just notice this. This is Glandvax 3. One other brand actually is saying every 4 months that goats will require vaccination. So you have the 2 priming doses, and then you have to vaccinate at least every 6 months. If you're feeding a lot of grain, then you may have to vaccinate more often than that, and say 3 or 4 times a year. Now, the pack, once it's open, can be stored for 30 days, so long as you use very hygienic methods. Wipe the top of the vaccine with methylated spirits. Only ever put in a sterile needle. Sterile needles are very cheap to buy, a pack of 100, and you should use them. And this is the disease they prevent. So these goats were just found dead, died of enterotoxemia, and you can see they may or may not scour, but they will be found dead. You can use Glandvax 6, which comes in a smaller pack, but research in the United Kingdom done a while ago now showed that with the multi-vaccines, you get very poor protection against enterotoxemia. So if you are using Glandvax 6, then I'd probably use it more often than I would Glandvax 3. And the Glandvax 6 will develop more swellings and more lumps. I wouldn't recommend 5-in-1, and the reason being that it does not provide any protection from cheese gland or caseous lymphadenitis. And this is what cheesy gland generally looks like. The lymph nodes are infected, and these will actually burst, and that infectious pus then contaminates your environment. So that goat must be isolated, must be lanced as soon as the hair has gone off it, and flushed out twice a day with that pus collected and disposed of carefully. So 5-in-1 provides no protection against this disease. And this is one of the reasons I personally do not vaccinate underneath the ear, as is suggested on the label for sheep. Because when I'm telling people about buying goats, I say, have a look under their ears, see if there's any scar tissue. And it's very hard to tell the difference between a vaccine reaction, which can produce a lump, and a cheesy gland abscess. So that's why I like to do it behind the shoulder. Vaccine storage is very important. Vaccines must be stored in a good fridge. That fridge should be labelled for animal medicines only. And I also use a data logger just to check that there's no change in temperature. And you can see here, I've got an alarm system here and a visual display. So I know that vaccine is always kept at the right temperature. Okay, this is, again, just reinforcing that your vaccines can be used up to 30 days. And this is where goat clubs have a good way of sharing vaccines. It's perfectly legal to share a drench container or a vaccine pack, as long as the box and the instructions go with it. But you must take care. You must ensure that the person or people that you're sharing the vaccine or the drench with take biosecurity as seriously as you do. And on my website, I do have some guidelines for goat clubs that want to share vaccines or share drench containers. The other thing I wanted to talk about is a relationship with a vet. You can see that for drenches, you're going to have to need a vet to give you a technical advice note. Contact them early, get them to come out and visit your property in order to write that technical advice note that must be done once a year, and get to know them. There's no point in ringing up ringing around trying to find a vet at midnight because you've got a kidding doe with a kid stuck, they're not going to be very appreciative. But if they've been out to your property, you've told them, you've employed them to write you technical advice notes for drenching, you've discussed your husbandry with them, then and warned them that you're going to be kidding certain dates, then they're going to take your call at midnight. Make sure you've got some reasonable facilities to restrain your goats. Goats don't do well in crushes and races. If you're building a race for goats, make sure it's very short, because goats will pack up and smother the bottom ones if you've got them in a long race. But the restraint could be just as simple as this little metal container here and a carabiner from a climbing store and a good collar and some ropes, and that's all you need. So you can then just have a good facility undercover if possible, at least in shade, so that you can restrain your goat, and having up against a wall is a good restraint. A milking bale is not the best if you're collecting blood samples, because you can't actually get at the neck. So that's why I like this setup as better. The vet's going to can legally supply you with small amounts of drench and vaccines. This is, again, a Q-Drench that I provide to a client with a prescription, and it's better than buying a litre of Q-Drench, which probably is going to expire before you use it all up. You can get that from your vet. And similarly with vaccines, they may provide vaccines for you. You can use PhoneAVet. I'm one of the vets on PhoneAVet. I only take goat calls. But you need to be able to provide a full history and the clinical signs, because otherwise it's a waste of time using PhoneAVet. So everyone should have a thermometer, because the first question I'm going to ask and going to expect you to be able to answer is, what is the rectal temperature? So these are the normal range for goats, the respiratory rate, which you can take yourself just by looking at the goat's chest movements. The pulse rate may be more difficult, but you can do that by just finding the pulse and counting them. Rumen mates, again, put your ear to the left-hand side of the goat, and there should be at least one every 2 minutes. And the normal temperature is 39.3 plus or minus 0.5. And now open that up to questions.